Welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens. Today we're going to dive into one of the most robust studies conducted on AI trust and governance. This is a 2025 report from the University of Melbourne and KPMG. It's not a vendor survey. It is an independently conducted study based on 48,000 people across 47 countries. It includes not just the general public, but also employees of organizations using artificial intelligence and students, which gives us a broader view of how artificial intelligence is being used and misused in the real world. For healthcare systems, this report is a goldmine. It is full of fascinating insights and interesting tidbits to take away, actionable things that we really can do to help promote trust and responsible use of artificial intelligence. Because while clinical AI tools promise to save lives, public trust and internal governance is a large part of what's going to actually determine the success or failure of those tools. So before we get into the takeaways, I want to emphasize the rigor of this research because it really blew me away. This is a huge study. And not all AI studies are created equal, but this is the fourth wave of a longitudinal study. So it's tracking how perceptions are changing over time, especially in that post-November 2023 ChatGPT boom. This study included 48,000 respondents across 47 countries, data from both the general public and organizational users of AI tools, like employees of tech organizations and students. They provided detailed demographic breakdowns, age, education, income, AI literacy, and they really wanted to probe AI's impacts at work, in education, and in society. So they asked people about their use of AI tools at work. They asked about their fears. They asked about their concerns, their general assessment of their own literacy levels. It's a really fascinating study. The lead researchers, who included Dr. Steve Lockey and Professor Nicole Gillespie, they worked independently with a multidisciplinary advisory board, and their methodology included comparing across countries, doing statistical tests, and really careful attention to cultural and economic context. So, for example, they did a lot of breakdowns between emerging economies and established economies, just to kind of see if you're in an economy that is building and growing, how do you feel about artificial intelligence versus if you're in a well-established, possibly more tech-literate economy, how do you feel about artificial intelligence? Overall, the entire thing is an amazing resource for understanding how people use and think about artificial intelligence. So the key takeaway, and the first thing that really struck me about this, is that even as AI adoption is surging, public trust in artificial intelligence remains shaky. So adoption of AI is outpacing trust in AI. Trust is actually eroding as more people get their hands on these tools. And I do want to drop a pin in this because I think that's a good thing. I think it's really easy to trust when somebody is selling you a marketing hype. And then once you have your hand on the tool, you feel a little deflated. Your expectations are now meeting reality. So no, we shouldn't trust it 100%. No one ever should. The more you play with it, the more you start to get a feel for when it can and cannot be trusted. So from the study, 66% of people are intentionally using artificial intelligence. So that's a 2/3 majority. 54% of people are nervous about trusting it. It's so interesting that adoption has outpaced our trust. In advanced economies like the United States, that trust is even lower. Only 39% of people express trust in artificial intelligence. But here's what's interesting. Healthcare institutions are among the most trusted to develop and use AI responsibly. I'm going to pop a figure up right here. So this is figure 10. This is trust and acceptance of AI systems. It shows that trust in AI in general, only 46% of people are willing to trust it. For human resources AI, slightly lower, 42%. But healthcare AI, we actually see the highest willingness to trust out of any of these sectors. We see a willingness to trust of 52%. This is fascinating to me. It says that there's opportunities in healthcare that there may not be in other sectors. And it also says that, oh boy, this sword cuts both ways. When we deploy AI in clinical or operational settings, people expect us to get it right. They trust us. So we have to be very careful stewards of that trust. So I wanted to talk about takeaways from this survey. I wanted to talk about things that you absolutely must do as a health system if you're doing good AI governance. So thing number one, build a governance board, right? If you don't already have an AI governance board, I keep beating this particular drum. I really, truly feel that your institution needs a local AI governance board. And here's why. Only 43% of the respondents to the survey thought that current AI laws were adequate. People expect, especially in the healthcare sector, co-regulation. They expect government and industry and internal oversight. Our federal government here in the United States has clearly expressed an interest in delegating the regulation of artificial intelligence to the industry sectors. We're also seeing very clear legislative moves towards discouraging states from coming up with their own AI regulation, which is honestly a good idea because a patchwork of really varied state legislation is going to be very difficult to navigate as a health system. But for healthcare, this means that our governance is down to us. We need to self-govern. There is no joint commission. There is no external auditing group that is going to come by and say your governance needs to be done according to this checklist. It's on us. So this means that we have to pull together our own internal stakeholders and our own internal subject matter experts and create that governance board and give them true authority to approve or disapprove projects. You can do this by using frameworks like the NIST AI Risk Management Framework or the EU AI Act, like an EU AI Act style tiered risk model to structure those reviews. So that's thing number one, governance board. Thing number two, you got to tackle the AI literacy gap. 61% of people who responded to the survey said they had had no AI training. That's not surprising, right? Like to date right here, I'm not sure that I have had formal AI training. I have had formal AI governance training, but I'm not sure I have had formal AI training. When you're employed, 66% of employees are relying on AI without verifying its output. That's directly tied to that AI literacy gap. So if you don't know how it's working, if you don't know what it can and can't do well, then you're not going to necessarily know when you might need to poke holes in its arguments or when you might not want to accept its output without fact-checking your references. A lack of AI literacy means that inappropriate use is widespread, which includes uploads of private or protected information to public large language models, which is something that really keeps me awake at night. If you're a healthcare organization, here's what you can do. So you can offer role-specific AI training for clinicians, administrators, and staff. What are the tools that are available to you? What can you and can you not do with them? You want to make sure that you're teaching people what AI can't do. Teach people how to look out for bias. Teach people how to look out for hallucinations. Teach people to not trust its very confident tone. Teach people how transformers actually work, and so that you understand the underlying architecture of what a large language model is doing. Even if you call it reasoning, this is a question for the philosophers, but let me tell you, it's hard pressed to say that it represents human reasoning. I do want to recommend that you normalize discussion of AI use in your documentation and in your huddles and set organizational standards for AI disclosures, which I'm going to do in this podcast just to show you. I have an AI disclosure at the end of every presentation that I do, even if it's one that I completely human generated, just because I think it's nice to make sure that people know what parts of the content that you're presenting are done in collaboration with an artificial intelligence and how. That's really helpful in building that ground level fluency with how to use AI in ways that are beneficial. So if you're setting standards for AI disclosures, that helps set up thing number 3 that you can do as a health system. You want to watch out for complacent use. This is the part where I could feel like all of my HR friends start to get a little sweaty. 50% of employees on the survey reported breaking policy to use artificial intelligence. So they knew they weren't supposed to use it and they were doing it anyway. 40% of employees admitted to hiding their artificial intelligence use. And 67% relied on AI outputs without validation. Okay, that is not just a security and a management issue. That is a governance failure. As an organization, people are going to use artificial intelligence. We've seen that time and time again. So let's build guardrails. Let's communicate about it. Let's not shove it under the bed. Let's pull it out in the open and teach people how to do it responsibly and safely and effectively. You'll be much more effective if you're not feeling like you're a criminal for just trying to use this technology. So how do we do that? We create and we communicate clear AI use policies. We set norms for disclosure, and not only in clinical settings, but also in operational settings. If I'm giving a presentation, can I disclose, hey, I used Dolly to come up with this picture? Let's make sure that we have audit trails for AI-assisted documentation in the clinical setting and regular audits. The audit trail doesn't do you any good if it's just there. You have to look at it. And you also, when we talk about complacent use, right, we talk about relying on the AI output without validating. Be aware of algorithmic bias. Be aware of groups of people who may be accepting the output of these systems and not questioning it. Make sure that you're measuring that when you're monitoring and report out on it. The thing number 4 that we can think about when we're looking at AI in a healthcare setting is that equity is a problem. I don't like the way that sounds. We'll say fear of lack of equity is a problem. So AI risks and worries that were reported in the study included misinformation, but also some serious human rights violations like job loss, privacy invasion, and then biased outcomes depending on how a person belongs to specific groups in society. Especially in the US, these equity concerns are eroding public confidence. And in healthcare, we truly do have a moral obligation to treat all of our patients with the same quality of care regardless. So when you're doing your model development, when you're doing your validation, when you're doing your post-deployment monitoring, you have to run equity audits. You have to make sure that your tools are treating all of your groups of patients equitably. And you want to make sure that your training data reflects the real diversity of your patient population, while also being aware the healthcare data itself is reflecting the bias inherent in the system. That's my favorite Monty Python quote, right? We have to be aware of the ways in which bias infiltrates all of our systems from the very beginning, and design our systems so that we can still have equitable outcomes, even if our inputs are biased. Thing number 5, assurance mechanisms can buy you trust. So 80% of people say that they would trust AI more if assurance mechanisms were in place. That includes designing your processes to include humans in the loop. It includes transparent error reporting and encouraging error reporting. It includes not just monitoring, but independent audits of the processes. The more people you have looking at your outputs of your models and your outputs of your tools, the more trust you're going to build, not only internally, but also with your patient and your public population. If you want clinicians or anyone to trust your tools, you have to design for trust as a desired outcome in addition to your operational metrics. And then you have to measure it. And you have to continually manage not only to whatever it is that you're hoping to do with the tool, but also to the trust in the tool. So if 58% of employees across industries are already using AI tools at work, most of them are using public tools like ChatGPT, so not an internal platform. That means that if you're an organization that it has some of these employees who are using ChatGPT, you already have a shadow AI ecosystem. It's by definition not secure, and it's probably growing, and you don't have a way to validate it or its output. So step 1 is to take a deep breath and bring it all into the light. Run some internal surveys. Talk to people. Who's using AI? How and why? If you're using an external tool rather than an internal one, why is that? What is it offering you that you can't? You have to offer safer, governed alternatives within your firewalls and your protections. And you have to elevate responsible users as champions and not rule breakers. Show responsible use as something to emulate and aspire to. One of the researchers in the study actually put it, we're in the age of AI performance, but also AI dependency. And if you have people who are dependent on tools that your organization doesn't manage, that really can outpace your governance and put your organization at risk. So what do we take from all of this? The study from KPMG and the University of Melbourne offers a really clear takeaway that governance isn't an obstacle to innovation. It's the foundation. We've had plenty of hype for the past several years about what AI can do, but in order to realize those very real gains, we need interdisciplinary governance boards, real AI training for our employees, and public transparency and internal accountability, because if we're going to do this, we need to treat trust as a measurable, buildable resource. Thank you for listening. If this helped, share it with somebody on your compliance or your leadership team. I would love to hear their take. Finally, I promised I would always do an AI disclosure, and I need to update mine. I prepared this podcast and will continue to do so in the future with the assistance of a custom trained GPT. Be delighted to talk about how I trained this GPT in the future. It was really fun. I gave it the PDF of the KPMG study and asked it for a summary and then for a podcast script built off of that summary. I suggested some changes to the script to include the methodology, and then I fact-checked the revised script. I added some details, I removed some content, and I made the end product more my own. Now I'm recording this. I'm going to edit this with the use of an AI-generated transcript, and I'm going to use my GPT to help me generate some social media posts on this. Thank you for listening. I always appreciate your comments. Please give me your feedback. I can't wait to hear it.